Hi, my name is Carly Gass, and I'm going to be conducting the chest and lung examination with my volunteer here. I just want to say thank you for helping me with this school assignment.
You're welcome.
Before we start the examination, I just need to ask you a little bit of history on your chest and lungs. Have you ever had any thoracic or nasal surgery?
No.
Have you ever had any trauma to your thoracic or nasal area?
No.
Okay. Have you ever been hospitalized for any pulmonary disorder?
No.
Okay. Do you use any ventilator-assisted devices?
No.
Such as, okay, good. Have you ever had any chronic pulmonary diseases such as bronchitis or emphysema, asthma?
No.
Do you have any chronic disorders, cardiac or blood clotting,
No.
cancer? Have you ever been tested, done like a pulmonary function test or?
No.
Okay. Are you up to date with your flu and pneumonia vaccine?
Yes.
Good. And does your family have any history of bronchitis or tuberculosis?
No.
Okay. And have you been exposed to any hazardous chemicals that may affect your pulmonary functions?
No.
Do you use tobacco?
No.
Okay. And do you have any chest pain or shortness of breath when you're doing physical activity or when you're at rest?
No.
Any chest pains at all?
No.
No. Okay. Okay, so we're going to start the physical examination. Thank you. The first thing I want to do is just to check the symmetry and shape of your chest, making sure they should be symmetrical on both sides, and the shape, it should not be barrel in any way. And the anterior posterior diameter should be less than the lateral diameter of your chest. And it looks like to me that it's in proper positioning. I'm also going to be checking your respiratory rate and rhythm. Now looking at that, I can see that you're not breathing in any labored fashion. You're not using accessory muscles. Just gonna check your pulse here. Okay. Okay, so your respiration is 18 and your pulse is 80, and that's a good ratio. 1 to 4 is the pulmonary cardiac ratio.
Okay.
Now I'm going to just take a look at the landmarks of your chest and trachea. Trachea should be midline, no deviation should be noted. Right below should be the suprasternal notch right here. Here are your clavicles. And right below the notch is the angle of Louis. On the back, if I ask you to please bend your head, feeling at the back, the first prominence will be here, the C7, the cervical C7, and right below the second prominence would be T1, and those are very helpful landmarks. So is everything okay?
Yes.
Okay, good. Thank you. And what I want to do is just listen, also make sure that there aren't any audible wheezing. I don't hear any wheezing. I don't hear any stridor also in your breathing. We're going to do some palpation. I'm going to just touch your chest area. First, let's do up here by here. I'm feeling for crepitus, which is sort of like a crackling feeling here. That would be indicative of maybe some air stuck in the subcutaneous tissues, and that's crepitus. And with the pleural friction rub, it's more of a louder, coarse grating sound. And that would be with the pleural viscera. If they're inflamed, they're rubbing against each other, it's more like a leathery sound. I don't hear anything at all. We're going to be just asking you to now just take a deep breath. I want to take a look at your thoracic expansion. Just take a, stay straight for me. Let go. Deep breath. Deep breath in and out. The expansion should be symmetrical on both sides here. And I'm going to ask you to say 99. This is the tactile fremitus. See 99.
99.
Again.
99.
Again.
99.
99. Okay. So if it was louder, it would indicate maybe some fluids or edema in the pleural cavity. If the sound was less, it might be for maybe excess air or pleural effusion. Okay. So far how you're doing?
Okay.
We're almost there.
Okay.
Almost there. Now I'm gonna try to percuss your chest area, where I'm still listening for any sounds that are abnormal in the area. For healthy tissue, the sound should be resonance, and that's what's expected. So I'm just gonna ask you to just relax while I just listen to your sound. Okay, so that I don't hear any hyperresonance, would indicate maybe emphysema. Just can you lift your arms up for me on both sides, or we're gonna do it laterally. We're supposed to be comparing both sides to make sure it's resonant, so everything sounds healthy to me. Okay, you can put your arms down.
Okay.
Now what I want to do is measure your diaphragmatic excursion when you're taking a deep breath in out, and I'm going to be using some tape, which I have prepared right now. So I'm just going to measure how far your diaphragm expands when you take a breath, okay? So what I want you to do firstly is just stand straight for me and just take a deep breath. And I'm going to percuss up to the point where I hear dullness. I'm gonna mark it. Let go of your breath. Breathe normally. Okay, you okay? And now you're gonna take a deep breath again. I'm gonna go to the other side. Mark where I hear dullness. Okay, breathe normally. Normal. Now I'm gonna be asking you to take in as much air as you can, and then you're gonna be exhaling, okay? So take in as much air, and now you're going to exhale for me. Exhale. Hold the breath out. Okay, from the part where you marked, you want to percuss up till you hear dullness. Let go. Breathe normally. Okay? I want you to take in as much air so you can exhale again. Now, exhale all that air out. Again, from the second marcation, you want to percuss up until you hear dullness. Let go of your breath. Just breathe normally. And we do the marcation again. Thank you. Just breathe normally. And we're going to measure the distance in centimeters. The normal distance should between the two marks usually is about 3 to 6 centimeters, and you're within normal range. You're like 4, okay? Now, using my stethoscope, I'm going to listen to your breath sounds, okay? First, I'm just going to listen to your breath sounds starting from the base of your lungs, because that's where, especially older individuals, they get a little tired. So I want to listen to the base, and just take a nice deep breath with me. Let go. Deep breath. Let go, please. So over normal tissue, you'll be listening to vesicular breath sounds, which are usually low in pitch and low in intensity. And over the trachea, just gonna listen to breath sounds. Take a breath. The sound is usually louder, higher pitch. And over the bronchus, it's more of a moderate sound. And on inspiration and expiration, it's usually equal in terms of the length of it. Okay, thank you. When I'm listening to your breath sounds, I'm listening for any crackles, any rhonchi, or any wheezing, which I didn't hear anything. If you had wheezing, maybe you could have been asthmatic. Crackles might be for pneumonia. And rhonchi is, if you cough, that should be able to be cleared up. And I didn't hear anything. I heard normal. And also for your vocal resonance, your voice sounds clear. I don't hear any gurgling or wetness when you're speaking, which sometimes is indication that somebody has like aspiration or has silent aspiration, and you don't have any of that. So your exam went well. So I just want to say thank you very much for helping me with this assignment, and this concludes our examination today.
Thank you.